Hello, and welcome to Optimizing Medicaid for Health and Wellness, Real Life Success Stories. I am sorry that we can't be together today, but we're all working in a virtual environment and we just have to make the best of it. So I hope to keep you engaged today, and I encourage you to go into the chat and put your contact information, name if you like to, and ask questions, make comments, etc. And at the end, we'll have some time, hopefully, to answer your questions. My name is Sharon Rich. I am the Senior Trust Advisor with AGED, otherwise known as Advocates and Guardians for the Elderly and Disabled. Our primary business at AGED is managing special needs trust. So all of our clients have some sort of disability, or they're seniors with a lot of medical conditions. I hope today that as we go through our stories, you will add some tools to your toolbox and get some ideas that can help you help your clients and the people that you come across to improve their health and wellness. So let's get started. Today we're going to cover Medicaid benefits. Not all the Medicaid benefits at all. There's a few programs we're going to focus on. Medically needy share of cost, you may have heard of that before. Low-income subsidy or extra help is a wonderful program to help people reduce their medication cost. Fabulous program. We deal a lot with QMB, Qualified Medicare Beneficiary Medicaid. It's a fabulous program that helps reduce out-of-pocket costs. I'm going to talk about that today. Long-term care is, there's a couple programs under long-term care, home and community-based services, and the institutional care program for skilled nursing. We're also going to cover pooled special needs trust. This is a way to qualify for Medicaid when you're over the financial limits. And I am not an attorney, just want to give you that. So I'm not giving you legal advice today. And this is born out of experience, and it's one way to qualify for Medicaid when you're over the financial limits. We do have our clients consult and work with elder law attorneys if they're putting assets into the trust. So that's very important to us and to the clients. Case studies as we weave through, again, I hope that you will think of people you know, and that this will give you some extra information so that you can help those that you know. So who are we really talking about that can benefit from these Medicaid programs? There are lots of people out there who cannot afford their medications or their copays. I talk to people almost every day that say, I need a back surgery and I can't afford it, or I need an MRI test and it's just not in my budget. I'm living on a fixed income and I don't have the extra money. Medications can also be very expensive for people. And so we're going to talk about Medicaid programs that can help to reduce these out-of-pocket costs. You hear a lot about food insecurities these days. Well, these programs, if we can help to reduce their expenses, can help to ensure that they're able to afford their food. Medicaid can also help people who can no longer work because of a disability. This is your population generally who is between the ages of 18 and 65 in Florida, and they've had a life event. They can no longer work. Maybe they have been in an accident, or they have a health condition that prevents them from working. So there are some Medicaid programs that can help these people also. Now you've also got your nursing home and assisted living residents, of course. That's what most people think about when they think about Medicaid, is the long-term care portion of it. And it is extremely helpful to people as they age to help cover some of those long-term care expenses. The average cost in a nursing home is over $9,000 a month in Florida, and your savings can really dwindle quickly with those kinds of costs that many people face. Developmentally disabled adults can also benefit from Medicaid. This is not the group that we're going to be touching on today, but they certainly can benefit from special needs trusts and Medicaid often. So when you meet somebody and you ask them, are they on Medicaid? And they say, yes, I'm on Medicaid. You say, well, what program are you on? They're like, well, I'm on Medicaid. I have Medicaid. And so it's our job to figure out, well, what kind of Medicaid do they really have? And Medicaid really is like ice cream. There are hundreds of different flavors. So they may be on something that is great for them. They may be on something that they need extra benefits for that can, they can get something that's a little bit better. So we're going to go through some of those programs right now. We're talking about Medicaid for the aged and disabled. So we're not doing family Medicaid in this program. This is your population, the age 65 and above, or disabled between the ages of 18 and 65 in the state of Florida, or blind. So this is the type of Medicaid that we're talking about today. Again, provides medical and long-term expenses as long as you meet financial eligibility based on your income and your assets. There's a couple other requirements. You have to be a Florida resident. So if you're moving from another state, you have to establish residency before you can apply for Medicaid here. So this is the chart that has the financial eligibility on it. And this changes about every 3 months, or it comes out every 3 months. And often the numbers change at the beginning of the year. Note here, there's a column for income for an individual and income for a couple. That's a married couple that's living together. The asset limit is here for individuals and the couples. So I'm not an attorney. I'm not here to tell you exactly what counts as income and what counts as an asset. But generally, I will say that Medicaid allows you to have a home equity interest, $595,000 right now, and a car. And just about everything else counts. So we're talking about, savings, checking accounts, investments, IRAs can count as assets or income, sometimes even annuities, cash value and life insurance, etc. So we're not going to focus on the asset side of things as far as what counts, but more of the programs that you can qualify for that are listed here. So you see this chart is sectioned off. The first section is programs managed by Social Security. Then you've got your coverage group for your 65 or older or a disabled population. Most of these are people that don't have the Medicare, although in some cases you might. It includes the Community Medicaid program. People with Medicare can often benefit from these Medicare savings programs, which we're going to go through in detail. And then down here is your institutional policy programs for ICP and home and community-based programs. So I want to introduce you to Paula Spratt. Miss Paula moved from Pennsylvania down to Florida about 10 years ago. She decided she needed warmer weather, and she was a very social lady, and she heard about the villages. So Paula just decided to move to the villages. She doesn't have a family. She's been single for a while now. So let's see how we might be able to help Paula. Right now, she's 78 years old, and she bought a manufactured home. She has a couple cats and a dog. So she loves coming into our office because we always have about 4 dogs in our office at any one time. So she's quite welcome here. Paula's gross income is $1,800 a month. That's her Social Security check. That's all she has. Now, her net payment that goes into the checking account every month is only $1,655. And that's because her Medicare Part B premium is being deducted from her gross income, her Social Security check. She still has savings of $15,000, but now she's starting to get some ailments. She has a little bit of anxiety. She's diabetic. She's gained some weight. She really likes to go out to restaurants with her friends and socialize and all that. But she used to smoke, and she's got some early stage COPD, and now she's got a bit of a heart condition. So she's taking medications for these things. Paula chose a Medicare Advantage plan. This is an all-in-one, Medicare plan. She could have gone traditional Medicare with possibly a supplement and a Part D plan, but she has an Advantage plan. So what are her medical costs right now? She's paying the $144.60 a month out of her Social Security check for her Part B premium. Her medications are running her about $300 a month now. Insulin is very expensive. We help a lot of people that are diabetic, and they're really trying to reduce their insulin costs. That can be overwhelming to a lot of people, unfortunately. Her plan has specialist copays at $45. She has to pay copays, for emergency room, hospital stays, etc. And her plan has an out-of-pocket maximum of $6,000. So, it can vary from plan to plan, but if she were to have an event where she ended up in the hospital or something like that, she could be subject to expenses of up to $6,000 for the year. And remember, she's living on a very, minimal fixed income. Household expenses for Paula, $1,600 a month. So she's got mortgage, she's still driving, car insurance, cell phone, food, cable, gas, the normal things that someone has to, pay to live. So between her household expenses and her medications, she's going into the hole. And then as she has additional expenses every month, she's dipping into her savings to have to carry on. So let's talk about a few programs that might help Paula or somebody else that you know. Low income subsidy or extra help. It's known by both names. This is a fabulous program. Note the income limit, $1,595. That's for gross income. And you're allowed to have $14,610 in assets. So Paula doesn't qualify for this program. Her income and her savings are too high at this time. What does extra help give you? This is to help cover prescription drug cost. If you get qualified for this, your medication costs will go down to $0 to $10 per script. Now, like any other prescription drug plan, you're going to look at your plan or the other plans that might be available to make sure that your drugs are covered. But typically, most all drugs, $0 to $10 under this plan. Part D annual deductible, if you have one, that can be over $400 this year, is mostly paid under this program. If you have a Part D premium, that's your prescription drug plan, This program will pay up to maybe about $35 or so towards that premium, and it keeps you out of the donut hole. Many of you might have heard of what the donut hole is. Generally, basically, the donut hole is when your total cost of drugs reaches about $4,000 this year, then your copays go up. So at the beginning of the year, you're making smaller copays. If you're in the coverage gap or the donut hole, your copays are going to be larger. So medications can get very expensive when you're in the donut hole. This program keeps you out of the gap. So if you think that one of your clients may qualify for this and they don't already have it, it's run by Social Security, so you can call Social Security and get signed or apply for this. Great program. So now I meet people a lot of times. I say, well, what kind of Medicaid do you have? And sometimes they'll say, well, I have something that, has a share of cost or something like that. Okay, that's medically needy share of cost. A lot of people apply to Medicaid. This is what they get put on. And why is that? Because look, there's no income limits. So there is an asset limit. Countable resources, $5,000 for an individual. A lot of people that I know and meet have no savings. They're living from check to check every month. This is what they get put on. How does it work? So you have to meet your share of cost before you can get Medicaid. And this starts over every month. The government calculates your share of costs as your income less $180. So in Paula's case, it would be, let's say, around $1,600 a month. So she would have to incur medical expenses of $1,620 each month before Medicaid kicks in. So when I met my client, George, he was on share of cost. And what was George doing? George had chest pains at the beginning of every month, and he was ending up in the ER room. This way, George could meet his share of cost. And his income was right around the $1,800 mark, so he was incurring that $1,600 bill at the beginning of the month. And now for the rest of the month, George had Medicaid. He could get his scripts filled, he could go to the doctors, things like that. This is a very difficult program to manage. What we do a lot of times is help people qualify for something that's better than this share of cost so that they can really have Medicaid all of the time, not just part of the time. One good thing about share of costs that some people may not know is that when you meet your share of costs during the month, you then qualify for a Medicaid dental plan. So this is a way that some people can get dental services. So what are some other programs? These are Medicare savings programs. So these are for people who have Medicare already. Now Medicaid is now going to act as a supplement. So Medicare is primary, now you've got Medicaid also. As we know, Medicare only pays about 80% of the cost of things. So who's going to pay that extra 20%? One of these programs will cover that 20%, which is QMB. Note that these have different income limits. They're all a little bit different. The resource limit is $7,860. You apply through DCF for these programs. I want to talk primarily about QMB. It has the most benefits out of any of those programs. If you can qualify for QMB, then you are going to get extra help for your drugs. That's automatic with the program. And So drugs are going to be $0 to $10. Great. What else is really nice about this is your Part B premium is going to be paid for you. So with Paula, she's getting $144.60 deducted out of her check every month. If she can get qualified for this, then she is going to be able to, her gross income, her income check will go up. Medicare deductibles are paid by Medicaid, and the coinsurance, that's at 20%, is covered. So you really have Medicaid as a supplement to your Medicare with this plan. With these other Medicare savings programs, I call them SlimB and QI1, you do not get the coinsurance or the copay coverage. So if you have copays or you're subject to that 20%, you don't have a supplement, then you're going to have to cover those expenses yourself. With QMB, you don't. So that's the big difference. SlimB and QI1 also do pay your Part B premium and give you the extra help. So dear Paula, what happens to Paula? She got the flu and she went into the hospital for 6 days. She was discharged back home after she recovered, but her lungs were a bit compromised. Now, she couldn't do everything that she used to do. She became a little bit depressed. Now she's got more medications, inhalers, depression meds. They put her on blood thinners, and now she's got to have oxygen part of the time. So her medical bills are starting to add up. She has a $2,000 hospital bill. Her monthly medications have now increased. She has more copays now. She has to go to more specialists. She has to pay for the oxygen. Is Paula going to take her meds? Is she going to go to the specialist like she needs to go to? Or is she just going to say, I just don't have the money to do this? Does she have enough money to buy her own food? Or is she choosing between her food and feeding her pets? What programs do you think might benefit Paula? Several of these will, but Paula is not able to qualify on her own because her income and her assets are too high. So I'm going to pause here for just a moment and ask that you take the time to input any questions you might have. We've gone over a lot, comments, anything like that into the chat box. All right. So we're going to talk about pooled special needs trust. This is one vehicle, one legal way to qualify for Medicaid when you're over the financial limits. Your income and your assets can be transferred into the trust. One of the rules is that you have to be disabled. That means in Florida, if you're under 65, you're going to be on some kind of Social Security benefit, SSI or SSDI. If you're 65 or older, a disability determination needs to be done. All that means is you're providing medical records to DCF, and they'll take care of getting that determination done. If the individual is 72 or older, it's important to understand that the any impairment will be considered to be severe. So I have to kind of pre-qualify people. I ask them, when's the last time you worked? Are you able to work? That kind of thing, because in order to use a pooled trust, you have to really qualify medically to be able to be considered disabled. Trustee must be a nonprofit organization. There's around 10 pooled trust companies in the state of Florida. What do we pay for when there's money in a pooled trust? We can pay for things that the government benefits don't pay for. I'm not going to use your money to pay for things that the government might pay for, as long as it's for your sole benefit. So I'm not going to pay for, Barbie dolls, swing sets, things like that. We have to make sure we're using sole benefit rules for our clients. There's one big rule that says at the end, after death, if there's any money left, then you must pay back Medicaid before any money goes to heirs. So some of the pooled trust documents do allow you to name heirs, but Medicaid has to be paid back first. Here are all the codes that make it legal: federal, Social Security, and the Medicaid policy manual. Right here out of their manual says a pooled trust for disabled individuals is a legal instrument, meets the criteria in the U.S. Code, and allows disabled individuals to place assets and/or income into the trust to qualify for Medicaid. The concept on a pooled trust: there's a master trust that's already drawn up. You're going to complete a joiner agreement, fill in the blank document, and a fee agreement to create the account, fund the account, and then you can apply for Medicaid. There's no waiting period to qualify once the money's placed into the trust. So you're reducing your countable income and your countable assets by using a pooled trust. Again, you're going to be working with an elder law attorney if you're going to put assets into the trust. So in Paula's case, she's got $1,800 going into her checking account every month, $15,000 in assets. She's going to put the overage. We're going to get her qualified for QMB, Medicare, Medicaid, so she won't have to pay those copays, and she can reduce her medical expenses, her medication expenses. Every month, she has to put $800 into the trust to reduce her income below the limit for QMB, and she's going to put initial $8,000 in there to get her checking account below the limit. Now we're going to use the trust, right, to pay some of Paula's bills. She needs that money to live on. We can pay her mortgage on her home. We can pay utility bills, her cell phone bill, anything that's really for Paula, car insurance, those things. So we as a trust company pay a lot of bills for our clients. So this is the summary on what Paula does. She's getting qualified for QMB by putting her excess income into the trust every month and enough assets, and then the trustee pays her bills. That's pooled trust. What happens? Now the good news is Social Security check goes up by $145. That means her check is, instead of $1,655, it's going to be $1,800 every month. This typically will cover a trustee fee, but I can't speak for every trust company out there. That's the good news. And the medications, $0 to $10. Now she can afford those meds. I have people that I talk to that say, oh, I don't have a lot of medication costs. I just don't take what the doctor gives me because I can't afford it. So this will ensure that she can take the meds that she really needs. And she can go to the specialist, because when she does, she pays nothing. And now she can afford to feed her cats and the dogs and buy nutritious food for herself. But as Paula ages now, more time goes by, Paula has a stroke. She fell down. Fortunately, it was church day the next day. Her friend came and found her, called 911. Paula goes into the hospital. We've heard this before, right? I know you have clients that this has happened to. Fractured her hip. She's in the hospital 10 days, and they say, Paula, you need to go to rehab to get better. So the question is then, Paula's in rehab. What's going to happen in rehab? Is she going to have to go to skilled nursing or assisted living, or is she going to be able to go back home? And how is she going to be able to afford those costs? If she didn't have QMB, her rehab costs could be $176 a day. That's a lot of money. That's going to completely deplete any kind of savings for her within a couple months. So thank goodness she's on QMB. Briefly, the long-term care programs include ICP, skilled nursing, and home and community-based services. Now note on the chart that the income limit is completely different than the QMB limit. It's higher. And the asset limit, though, is lower, $2,000. So these programs are great for certain people in certain circumstances. Now, if you're married, There's a lot of other things that go into these numbers, community spouse allowance, etc. That's when you'll definitely be working with an elder law attorney. So if we could get Paula home and community-based services, what would she get? Maybe some medical supplies. She'd get an emergency response system that she could push if she fell. This is the program that pays for adult daycare. She'll have a case manager because she'll have to pick a plan, and maybe some home health care. So we're looking at maybe 10 hours a week, maybe more, maybe less, but it's not 24/7. So if she's at home, this is not going to provide 24/7 care for her. So meals, that's great. They need the meals. If she's in assisted living, it's going to pay somewhere between $1,000 and $1,300 towards that assisted living bill. This does not really cover your medical expenses, so you're going to need to qualify under different guidelines for the medical piece of it. The whole idea with home and community-based services was that it reduces institutionalization, right? Let people live in their homes longer or in the community. However, there's not enough funding to go around. So when you apply for this, you get put on a waiting list. You can apply through your area agency on aging. You have to meet certain, medical criteria. They will prioritize you. Now, while you're on the list, maybe you could qualify for medical Medicaid, the QMB, to help with those expenses. Here's the ICP that works totally different. You're going to, if you go on this program, you're going to owe the nursing home your income less $130. Generally, that's your personal needs allowance. That's called patient responsibility. So basically, you're giving your income less $130 to the nursing home. If you've got a Medicare supplement, you can deduct that if you keep that from the patient responsibility. And unreimbursed medical expenses can be submitted to DCF and can reduce your patient responsibility for a period of time. So just keep that in mind. And when you're on the ICP, long-term care and skilled nursing, your medications, all your supplies are supposed to be covered for you under Medicaid, okay? Can't give your money away. You've got this, penalty period for giving your money away. So that's not one way to qualify. Again, working with an attorney. Statewide managed care. That's how our Medicaid in Florida is provided. There's long-term care plans, MMA plans for the medical piece, dental plans. You got comprehensive plans that include long-term and medical, and some specialty plans. These are great informational sites for you. The snapshot gives a lot of information about the different plans in your region, what the minimum covered services are, and then the plans will have expanded benefits unique or to their plan. So choice counselors can help with the decision on which plans you need. So what are we going to do for Paula? She's in rehab. Can she go to ALF? She may, if so, it's wait lists for her. So what can we really do to help her? Let's get her on ICP going into the skilled nursing. She still has too much money to qualify in the bank for that. So she's got the pooled trust. She's going to add some money to the pooled trust. So now she can get down below that $2,000 limit. Now her income is not too high for this program, but she decides to put all the income into the trust anyway and let the trust pay the facility, her patient responsibility. A lot of our clients do that. She chooses a plan, and she doesn't need the QMB because her medical expenses are covered. Paula's been in skilled nursing now for more than 60 days. She's done her rehab, she's been good, and she's feeling better. So she's like, I don't want to stay here. I want to go back. I want to go to assisted living. They're telling her, you can't go back home, Paula. You need some help. So, but we do think you would be able to transition to ALF. So we're going to change Paula's Medicaid program over to the Home and Community-Based Services program. She doesn't have to go on a waiting list for this because she was already, on the ICP for 60 days in the nursing home. You might know that as Med Waiver. What happens now? Paula has to pay $2,800 to the facility. That's what they say their bill is. Now, most assisted livings are a little bit more than that, but Paula doesn't have a lot of money. So Medicaid's going to pay $1,100. She's going to pay $1,700. That's her $2,800. What else? Now she's got to also pay for medications. We're going to get her back on QMB, or she could possibly qualify for Meds AD. That's a whole nother discussion. But, fortunately, Paula has some money saved still through the trust. We can continue to pay her manufactured home bills for her during this whole time that she's been in facility. But eventually, okay, it's decided she's not going to be able to go back home, so the mobile home gets sold. So here we go. Paula has transitioned from at home with no Medicaid. She opened a pooled trust, got qualified for the QMB, helped her reduce her out-of-pocket medical expenses, extended the life of her money, rehab, then to ICP, and then to assisted living. And that way she's got her Medicaid help to really extend the life of her money. She wouldn't be able to afford this on her own. What have we done for Paula? We've helped her improve her health and wellness. She was able to take the medicines that she needed and get the medical care. It just breaks my heart when I talk to people that say they need this and they need that and they just can't afford it. So just know there are programs out there that can potentially help. Her money has lasted a lot longer. We pay for things for people in assisted living, such as an upgraded cable bill. We can pay for cell phone. Sometimes they have credit cards and they like to, go out to eat periodically. If they're still driving, God help us all, car insurance, those kinds of things. Paula liked to paint, and we would buy her oil supplies and things like that. So by having a little bit of money still left in the trust, it was able to enhance her quality of life. We've talked about these programs. I hope it's given you some tips and thoughts on maybe how you can help some people that you know. And again, pooled special needs trusts are one way to qualify for Medicaid, but please consult with an attorney when you've got resources to consider. These are some websites I put together for you that can be helpful to you. Note this balanced billing site here. When you're on the QMB dual eligible, the doctors that you see are not allowed to bill you. So this is the balanced billing statute on that, or information from CMS on that, actually, that sometimes we actually provide to the doctors for our clients to say, sorry, you shouldn't have been charging this person. And here's another few sites for you. The Medicare and You official handbook has a lot of great information about Medicare that's put out every year. You can get that online. So I thank you for attending today. Hope you have learned a lot and have given you some food for thought here. We like to be a resource to the community, so please feel free to reach out to Nick, our executive director, or myself, and please make sure you're putting your things into the chat box, and I will be able to stick around for a little bit, hopefully, and answer some of your questions. So thank you very much.